My name is Detlef Schuppan. I'm professor of gastroenterology and hepatology at the University of Mainz Medical Center. I'm also professor of medicine at Harvard Medical School. And one of the major specialties that we are dealing with, both clinically and research-wise, are chronic liver diseases, and of course, in particular, non-alcoholic steatohepatitis, which, as many will know, is the novel epidemic of chronic liver disease. So we are particularly interested in the progression of the disease towards cirrhosis, the complications of cirrhosis, and how to prevent the development of cirrhosis, and how to pharmacologically induce reversibility even of a cirrhotic liver. We also couple with that the development of novel non-invasive tools to assess the fibrosis of the liver, which is not that easy without biopsy. This includes the development of non-invasive serological markers of liver fibrosis, as well as the dynamics of the process. That means the progression, which we call fibrogenesis, as well as the reversal, when the liver reverses by, for example, a pharmacological treatment or lifestyle changes, which is possible, at least in pre-cirrhotic stages. And we call these markers markers of fibrolysis, removal of excess scar tissue. The book article that I have myself devoted to for the next year's issue is focused on the mechanisms and the, let's say, the factors that affect fibrosis progression in NASH. And there is new epidemiological data that indicate how and what patients progress most rapidly, what patients might reverse. There's good evidence that if you can induce exercise and weight loss, healthy eating in patients, this has dramatic effects, not only on the metabolic disease, which is type 2 diabetes or prediabetes, hyperlipidemia, hypertension, but also on the progression of fibrosis. It might even induce a regression. So one part is focused on this, and the other part is focused on some aspects, novel aspects of how the fibrosis is modulated by the immune cells. Here, the macrophages play a very important role, both in the progression as well as in the reversal, depending on the so-called phenotype and polarization, but also certain novel agents that are highly promising will be partly addressed, or class groups of medications that can potentially even induce a reversal of an advanced fibrosis, like compensated cirrhosis. And it is also stressed that the advanced fibrosis is becoming the most relevant, as we call it, endpoint in clinical studies and in patient outcomes, because it's finally the fibrosis, if it's advanced, that determines the morbidity, that means the sickness of the patients as well as the mortality. So we stress all these points and bring into play some novel ideas, novel aspects, also how, within the inflammatory context in the liver in NASH, the fibrosis progresses. And another novel finding, putting everything together, is that pure classical inflammation is not necessarily the direct driver of the fibrosis progression, but it's rather the reparative periods after a bout of acute inflammation that drive the progression towards cirrhosis.